The world's first malaria vaccine got a green light Friday from European drug regulators who say it should be licensed for use in babies in Africa at risk of the mosquito-borne disease. The shot is called RTSS, or Mosquirix, was developed by British drug maker GlaxoSmithKline in partnership with the Path Malaria Vaccine Initiative. Mosquirix, which is partly funded by the Bill and Melinda Gates Foundation, will now be assessed by the World Health Organization, which has promised to give its guidance on when and where it should be used before the end of this year. Malaria has killed an estimated 584,000 people in 2013, the vast majority in sub-Saharan Africa. Malaria has killed more than 80% of children under the age of 5. Now, Nigeria has hit a major milestone. It's been a year since anyone in the country has had polio, the crippling disease that mainly affects children. Although a lot of work still needs to be done, well, this achievement for Nigeria impacts all of Africa and the rest of the world. VOA's Carol Pearson has more.
Nigeria is the latest country to rid itself of the scourge of polio.
I think it became a sense of national pride.
National pride, as well as pressure from the international community and health leaders, prompted the government to commit to eradicating polio.
They were the largest country in Africa that had ongoing cases.
Getting all Nigerian children immunized was a huge challenge. It took the Nigerian government, thousands of volunteers, and help from the World Health Organization, UNICEF, Rotary International, and others to get it done.
The people, once they realize what needs to be done, they actually go out and get it done.
They tracked nomadic tribes, immunized children in areas of conflict during lulls in fighting, worked with leaders who resisted immunization on political or religious grounds and for other reasons. But even more vigilance is needed now, according to Carol Pandek with Rotary International, who spoke via Skype.
They need to continue to do high-quality immunization campaigns for the next several years. Also have a very strong surveillance system.
That's because the virus can hide in a person who doesn't get sick, but who can pass it on to others. Children need 6 doses of the oral vaccine in order to be protected from polio for life.
This is a milestone in Nigeria's polio eradication efforts, but certainly the job is not over.
It's a fragile achievement. If Nigeria stays polio-free for 3 years, the virus will no longer exist in Africa.
We're trying to wipe it off the face of the earth and make sure that no one is able to come in contact with it and get paralyzed again.
Now the focus shifts to Afghanistan and Pakistan, the only 2 countries in the world that have active cases of polio. If these countries can immunize all their children, the world will finally be polio-free. Carol Pearson, VOA News, Washington.